Hello and welcome to episode 41 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is talk to your patients. And I mean seriously talk to them. And if you are a individual struggling with low back pain who's listening to this, make sure that your providers are listening to you. This is crucial. And I'm going to dive into exactly why in today's podcast. Now, first, episode 40, last podcast, was all about what surgeons and many doctors are getting wrong about stenosis and how so many people with stenosis are told to avoid one particular thing, and it could be the very thing that could get them relief. So it's a mistake so many providers make, and I hear it all the time. So if that interests you, go listen to episode 40. But today's topic is to talk to your patients or to make sure your provider is listening to you. And the reason why I was prompted to make this podcast today is because of a very recent incident or scenario that I personally went through with a client that I have in Brazil. So to kind of set the framework for this, when most people go to a provider, in this situation, it's specific to low back pain, but it could be any injury. But it just so happens that low back pain, affects 80% of people alive and is the greatest incidence of disability amongst the human population. So therefore, it is a particular point of interest, and it influences more variables throughout your life than any other disorder does. So therefore, it's particularly relevant in today's conversation. But many times you go to your doctor, and you're in the appointment for 3-4 minutes, you're actually talking to your doctor, if it's a general practitioner. And if they're good, they'll refer you to someone who is trained in low back issues, like a physical therapist or a chiropractor. If they're not good, then they'll just try to manage you themselves, and they'll order an MRI, they'll order drugs, they'll order an injection. If it's a situation, of course, that doesn't warrant it, then that would not be the best advice. So then maybe you go to your physical therapist, you go to your chiropractor. And once again, these are, let's just say, relatively quick visits, in and out within 5 minutes, or maybe that the physical therapist's office, you're there for 20, 30 minutes, but you're just going from machine to machine to machine, or E-stem to ice, and they're just putting you through the same routine that everybody else is. And they're just expecting all of your issues to be related to your pain. And I know that you might be thinking, well, yeah, of course the issues would be related to the pain, but here's where that's not exactly true. We need to listen to people. We need to talk. We need to make time for them. Your doctor needs to have time for you. And if they don't, then it might be because you're, paying a cheap rate, and therefore they need to see a lot of people within a particular time frame. You're not getting you're not getting what you pay for, or you are getting what you pay for, which is minimal quality. If that's the situation, you need to find someone who's a little bit more hands-on and it can give you the time you're looking for because of the types of situations I'm going to describe, such as the one I just experienced with my client in Brazil. So I have a client in Brazil. She's been in the program for quite a few weeks now at this point and has had a dramatic transformation. She's just now hitting the halfway mark. Okay, and has had a huge transformation. Absolutely amazing. What I would consider one of my all-star clients. Okay, 10 out of 10 perfect. 10 out of 10 perfect for the last multiple weeks. She's unstoppable. There's nothing she can't handle. She's doing fantastic. Okay, and then all of a sudden, she reports a massive flare-up. Seemingly out of thin air. Hey, Grant, my sciatica's back. I'm flaring up. I'm having a hard time moving. I can't do this. I can't do that. All of these things that she's been able to do since like the second week in the program. Okay, it's like disaster struck. Now, if she was seeing, no, maybe or maybe not, but I'm talking about typical situations here. If she was seeing a typical clinic, going, doctor, I had a flare up. Okay, here's your painkillers and your steroid. See you in 2 weeks. Typical PT clinic. Okay, go ahead and lay on the table, put your E-stem on, we'll put your cold pack on, we'll calm it down, see us next week. Chiropractor, whatever version that would be. Go lay on the decompression table for 30 minutes and then let me max bill your insurance and then I'll see you next week. So I noticed that this didn't really make sense. She'd been doing so good. This client in Brazil was doing so good. And then all of a sudden, a massive flare-up out of nowhere. What could cause this? So instead of just throwing new exercises at her, saying, oh, well, try this, try that, go get an ice pack, go get a heating pack, take some medication, I decided to listen to her. Scheduled a call, wanted to talk to her about it because this didn't seem right. And I was ready to listen, and she needed someone to listen. So I talked with her. I said, hey, up until this point, you've been doing absolutely perfect. Halfway through the program, you're incredible. You've been out of pain, no more sciatica for many, many weeks. And all of a sudden, everything fell apart. She's like, yes, very stressed out. You could tell she wasn't feeling good. And I said, so between your last check-in with me, I do weekly check-ins, between your last check-in where you were a perfect score and the most recent one where you really, really fell off, what happened? Something happened during that week. What happened? So we got to talking. Oh, I don't know. I just some movements started not feeling good and this or that. And I said, okay, I understand the movements, the exercise started not feeling as great. But what happened? What happened in your life? What changed? I'm not concerned about the exercises. I'm not concerned about the rehab program. What happened? And then she said, oh, well, maybe it's because I started my menstrual cycle. Well, that's certainly a stressor. I work with many, many women and they tend to flare up around that time. Okay, there's a stressor. Sure, that could be related to it, but I don't think that's enough to cause this. What else happened? And then we talk a little bit more, and then she reveals that she had a lot of work-related stress, a lot of pressure at work, a lot of work-related stress, and that probably compounded too. So I said, okay, what else? And then she revealed that one of her best friends had just died. This compounding stress, these emotional stressors, this was the reason for the flare-up. And she needed to talk about it, and she needed to recognize that, to understand that this pain flare-up that she was having was not related to her biomechanics. It was not related to re-herniating her disc, re-injuring her nerve, doing a movement the wrong way. That's not what it was at all. It was the emotional and the psychological stressors that were placed on her from these three compounding things in her life that were causing this. And the moment she realized that, it was an aha moment. And she was able to understand the reason for her pain flare-up. She was able to then control it and understand this will go as I go through my grieving process. As I deal with these work stressors, this will go. And I will return back to just as good as I was feeling, and everything is going to be okay. And immediately, her mood changed. The next day, she told me how much better she was feeling, rapidly went right back to feeling incredible. And this would not have been discovered if I did not listen. And if she did not have an environment that was conducive to getting the time and the attention that she deserved. These things happen all the time. They happen all the time. There are so many emotional stressors that can create these flare-ups or these issues or different sources of pain throughout your life. Maybe you're going through a divorce. Maybe someone in your family's sick. Maybe you're on the verge of losing your job. These are just a few of many examples that can increase your pain, that can cause flare-ups, that can set you back. And just like if you're not moving the right way, right? You're bothering your back, you're doing certain movements that bother your back, right? If those aren't managed, then you're going to perpetuate your issue. But also, if you're not confronting and addressing these other areas in your life, your poor sleep, your work stress, your family stress, your relationship stress, then you're also not going to be able to find healing. It's the same thing. And you need to understand that these relate to your pain, and you need to talk about them, and you need to confront them. And if you don't have someone who's willing to listen to you and to give you the time that you deserve, it may be a very significant factor that is being overlooked and that is being missed. And thankfully, in the way that I work with my clients, we have unlimited communication. We have an extensive amount of communication, and I get to talk with my clients all the time. It's amazing. We talk all of the time. And I have conversations like this all of the time. All of the time. It is a crucial piece to healthcare. It is a crucial piece to rehab, specifically low back rehab. Yes, most of my clients were diagnosed with sciatica or, disc herniation, SI joint dysfunctions, nerve impingements, whatever. Yes, we are working through that. We are. Not denying that at all. But the mental component, the psychosocial component, the emotional components that are there along the way are a huge barrier to full recovery. They're a huge component, sometimes equal, if not more important than the original injury itself. So these things cannot be overlooked. They are crucial. And you need, if you're a provider, you need to listen to your patients. You need to set up your practice or your methods, your business in a way where you have adequate time to talk with people. And if you are a patient, you're a client, you've been struggling to find help and you don't feel like anyone's listening to you, you need to find a setup where someone has the time to listen to you. Because I'm truly blessed for the way that my program works, where we have all the time we need. Just our assessment alone, our initial assessment is an hour and a half for us to talk through all of these things and make sure that we're not missing any pieces of the puzzle. This is crucial. So I hope that this opened your eyes a little bit, whichever side of the deck you're on. I hope this opened your eyes a little bit to the importance of different types of emotional stressors or other life stressors that could influence one's pain. And to be able to understand that, to be able to embrace it, confront it, and address it appropriately and move on could be the single most important thing for your recovery. If you enjoyed this podcast, please leave a 5-star rating and review on Apple. It would help promote the podcast to others who are struggling with low back issues. And if you're watching on YouTube, please leave a like, comment, and subscribe to boost it on the algorithm so that we can share it with more people and share it with a friend who is struggling with low back issues and is struggling to find results. And if you are listening right now and you feel like you are not getting the time and attention that you deserve, and most importantly, you're not achieving the results that you're looking for, the most invaluable piece of it all, submit an application on my website. Let me help you. Let me learn how we can be a team and we can get you to where you need to be and get you the time and the attention that you deserve so you can get back to living your life at 100% quality. Don't forget to move more, move in nature, and move in the sun. Thank you so much for listening, and have a great day.